Welcome, everybody, and thanks for joining us today. We know that you're facing skyrocketing health insurance premiums and want to do everything possible to maintain employee benefits. That's why we partner with True Captive, so members can continue to offer high-quality employee insurance plans at a significantly reduced cost. So I am thrilled to introduce David Voorhees. He's the founder of True Captive, and David will share more about the VisionServe Health Alliance and then offer a free assessment so you can really see what the benefit and how much you will save with the captive. So with that, I'm going to turn it over to David. Welcome, David.
Thanks, Sue. Hello, everybody. My name is David Voorhees. I am the CEO and founder of True Captive Insurance, and my job over the next, we'll say, 45 to 50 minutes is to make insurance sound interesting and fun. Sometimes it's more difficult than it might sound, but I'm going to do my best. And then at the end, we'll leave time for questions if there are any. So that's me. I spent about 20 years in HR and operations in small entrepreneurial businesses, all the way up to global FTSE 100 businesses. And the one constant that was present at any business that I served was that the insurance company and the companies that I served never seemed to have alignment or the same focus or goal. And how I would define that is perhaps you have a positive underwriting year, meaning your loss ratio is 50, 60, 70%, but you still received an increase of any kind. And that never seemed like we could figure it out. So we had a successful exit from that business. And in trying to figure out what the next road was for me, decided to start an insurance company with that common focus is creating alignment with the members that we serve. So that's where True Captive started. This is my story, not necessarily our story, but since you get me today, I like to tell the story about my grandfather, and that's really where a lot of the foundational pieces of True Captive came from. Unbeknownst to me at that time, but he was a World War II doctor, started a private practice in Leavenworth, Kansas, and I was the young grandson that went with him on house calls. And I got to see medicine being practiced in a way that most people have never been able to see. And that foundational component was when we started True Captive is could we create an insurance experience where people would feel like they were being treated in their home, that they were treated with dignity and they were treated by someone who was an advocate for their care, which is counterintuitive for how the insurance experience works. And that's really what drove the idea of building something like True Captive. So before we get into some of the finer points, I think it would be good for us to start with relevant data from members of VisionServe who are part of True Captive. And so as we get in here, these are definitions, and I think Sue will probably send this out afterwards. But really, we're going to be talking about the differences of where people started when they came to True Captive, how they had done in their first year, and what they're on track to save or surplus. A lot of people scoff the first time I say this, but you can actually monetize your insurance plan where you're saving hundreds of thousands of dollars, if not millions of dollars, that you can forecast into your next year. So our two current members from VisionServe are American Printing House and Alpha Point. So we'll start on the left. American Printing House, when they joined, between what they were leaving, meaning their current plan, and the savings from their current plan was about $52,000. Uh, if you take into account the renewal, so we look at where they currently are, but when people join True Captive or any other insurance program, it's typically around their renewal time. When you estimate the savings from their renewal to True Captive, it was about $442,000. So at the point in time that we did this data survey, they had started this year in January, and this was done, I believe, in May, which would have been from April data. They had saved $123,000 in savings from the prior period of the year. So $123,000 savings in roughly 4 months. And then if they continue to perform at the rate that they are, by the end of the year, they would have about $1.1 million left over in their bank account. Not that they would have paid us. They would have $1 million in their bank account left over. So that's a pretty powerful example of how you can monetize your benefits. Alpha Point, they've been with us a little bit longer. They started a couple years ago, so some of this will show you a more longer term data point. So when they started, same thing, savings against their expiring contract was $38,000. Against their renewal, it was about $600,000 of savings. To date, in their claims alone, they've saved $2.1 million dollars. And that's very significant if you think about a fixed budget, that you have a surplus of $2.1 million dollars sitting in your bank account. And if they continue their surplus this year, they're going to add another $1.2 million dollars to that 2.1 million that they've already saved. So pretty powerful stuff to think about, that when you build an insurance plan that is in the image of the company you're serving and people can get maximum usage out of it that's relevant to them, these are the outcomes. And it almost seems counterintuitive, but I thought we'd start there so you can just see some real world examples of members of VisionServe. I think one of the big distinctions is, I mentioned we sold our last company, and in thinking about how do we create alignment with our members, we're the only insurance company in the country that invests in each one of our members' groups. What does that mean? So in a captive insurance plan, you're contributing collateral or capital to buy a part of the insurance company to participate in it. When I was pitched captives, and I'm a big proponent of captives, I think that, that's one of the things we have going right in insurance right now. Uh, they are member owned, so you're buying into them. With ours, I felt like if we were truly going to be in it with you, that our motives were the same. We can't make money until you save money. Then we should be the ones making that investment on your behalf. So we're actually cutting a check for every one of our members when they join and putting it at risk right next to your money. And that's that validation that our North Star is your North Star. And I think that's really critical in creating alignment. So anytime you talk to us during the year, and I'll talk to you about some of the things that we do that are a little bit different, know that we want your rates to be as low as we possibly can. If we can give people decreases every year, we will do that, because our investment will ride with your performance. And I think that's a really key distinction for us to keep in mind. So let's talk about what a captive is. Maybe you've heard about it, maybe you haven't. Really, what a captive is it's a purchasing organization or an umbrella over a group of companies that are not affiliated but singular minded, meaning they're wanting to take control of their healthcare costs and try to create a better experience. And if you look at all of the captives, they're designed to do that, is to create buying power for their members. And what they're trying to do is lower costs. They try to create better plans that you can get better usage out of them, reduce volatility, so ensuring that you're not seeing these massive spikes, and then seeing the data and that being transparent. Now, the term captive gets tossed around a lot, and I'll give you a quick definition. So, there are three parts to a captive, and most of them, most companies out there that do this are one of the three. So, there's the carrier side, which that's where all the claims occur, the transactions occur. There is the captive manager, that's where the real fun stuff happens. It's regulatory and compliance, and they work with the Department of Insurance. And then there's the program manager that works with the members and the advisors and brokers that do sell the product. Love to be able to tell you I was the smartest guy in the room, but I wasn't. This is just a happy accident. When I left working for other businesses to start True Captive, I thought, well, if I'm starting an insurance company, I need to start with the Department of Insurance. And so we became a captive carrier that is domiciled here in the US. So we're regulated by the Department of Insurance in Delaware. We are our own captive manager, so we work on regulatory and compliance with the domicile. And then we are our own program manager, meaning we work with all of our groups and all of our advisors that work with us. So when you look at other captives, they're typically one of those three. We happen to be all three, and it was a very fortunate accident. I'm very happy because it allows us to control the entire experience versus letting go of one piece. So who's a captive for? Really, if you think about this talks about membership of 50 to 1,000. When we first started, we were thinking in terms of what number is the right number to make sure that they can participate in a captive. And so that's where the 50 to 1,000 came from. But really, for us, it's what is the amount of risk you're able to accept and be responsible with. So when we look at municipalities, nonprofits, school districts, we're very focused on ensuring that there's maximum protection and that we're protecting your cash flow. Because it's really important when you're working with someone on a fixed budget that you ensure those things are solid and tight. Because unlike another company that might have additional funds that they can go get, when you have a finite budget, you don't have that. And so we need to make sure that your insurance plan's set up. So who's a captive for? Really, at the end of the day, it's somebody who wants to take control of their insurance plan and create something that their employees get better access from. You as an employer get better outcomes from financially. And finally, it's something that you can monetize and not be a burden on your balance sheet, but be something that you're more managing from a balance perspective. And so everybody wants to seek savings. That's important. And even though we work in a commoditized industry and that should be your focus, there are many other components to it just beyond that, because if you're fighting every year to find the lowest price, you're going to miss out on the opportunity to have the experience that your employees appreciate. And then that leads into culture, that leads into retention, which I know is really important at your level. You want to have control. So you don't need to want to run an insurance company. In our program, you don't own the insurance company. But you do want to have more flexibility in creating something that you think works for you. And then when things do occur that needs strategic resources or a decision, you're able to be a part of that decision versus being told what you can and can't do. Okay, so let's talk a little bit about what it looks like switching. So if you've ever switched carriers, so if you've ever been with Blue Cross and moved to Aetna, or you've been with Cigna and moved to United, or somewhere in between there, that's about the extent of what it feels like from a I'm changing from this to I'm changing to that. You just get a different card. Now, we only have one non-negotiable. We don't really focus too much on what carrier network you want to use. So when you use a captive, typically we're renting a nationwide network to be the underlying logo on the card. So when they go to the doctor, they still have Cigna, for example. So we don't really care too much what the network is. We don't care about what the other partners are. You get to keep your own broker. We don't dictate that. The only thing we ask is that we meet with you every 30 days. It's typically 20 to 30 minutes. The first 10 to 15 are talking about performance, so you know where you are from a cash flow perspective. You're benchmarked against other members in the captive. But the other part of the meeting is really where the fascinating things occur. It's the anecdotal components, because many of your companies, you know your employees, you know their families. You know when someone hits hard times. You know when someone gets diagnosed with something that's really not fun, or they're prescribed a medicine that's very expensive. And when we're able to help the experience for the employee, we're also able to touch the expense of the company and the insurance. And so when we're on those calls, we're talking, we're listening, and we're able to get our hands around things before they occur, which is very, very helpful in helping your employees understand that you picked a product that cares about them, and that also financially we're able to create better outcomes than we would had we not otherwise had that conversation. And so you'd be surprised how many times on calls we hear this and we're able to engage. The other piece is the bill structure. There's not a lot of difference in how your bill comes, other than it's going to come twice a month instead of once a month. Doesn't mean that it's more, so you're getting two bills that equal the same. It's part of your expense is fixed cost, which is just premium alone. Right now, for most of you that are fully insured, your premium includes the premium and the claims. In a captive, you're only going to pay for the premium. The claims are what comes on that other bill. So you only pay for claims if and when they occur. When you're in a fully insured product, you're paying for a predicted amount, whether it occurs or not. So this gives you that ability to create a budget based on your total, because you want to budget for your total, but anything that you don't spend to that total is your savings completely and no one else touches it. So those are really the only two differences when you're switching. This is what your employees can expect. Everything that you would have in traditional insurance, meaning you've got the quality coverage, you get an ID card, you go to the pharmacy, all of that stuff's the same. The difference is in true captive, you're going to have advocates and resources that will allow you to have access to different tools and access to different locations and access to different strategies that allow people to access things that they otherwise wouldn't. So being in network and out of network is still a thing, but if somebody's out of network, we can help them. If there's an opportunity for us to create a single case agreement, which is an agreement between the insurance company and the facility or provider, where we agree to pay a certain amount, oftentimes that amount is at a discount, and you could tell your employee, hey, instead of paying your 50 or $100 copay and your $1,500 out of pocket, we're going to waive that because the expense was so dramatically low for us that you don't need to pay that. And those are really meaningful to employees, especially in roles where wages do not meet some of the prevailing wages. And then finally, the custom programs. The most important part here is you can use any plan you want to. So if you like the ones that you're currently on, you can. But if there are things that you want to do, like waive copay and out of pocket for direct primary care, because a lot of employees use it, a lot of families use it, and you don't want anything to prevent them from going to see regular medicine, you can do that. That's not going to cost you anything differently. Okay, so this slide, the first time I ever showed it was at the VisionServe conference, and our head of marketing thought I was nuts when I said I wanted a slide that had somebody peeing in the pool, but you'll understand what I mean as I talk through this. So in insurance, no matter what kind of insurance you're in, technically you're in a pool with other members. Whether you know it or not, people are pooling that insurance risk. And in that, you've got members who are more focused on cost containment, focused on being uh, the right type of consumer and doing the best they can to save. And others, whether it's intentional or not, they don't. And so if you're in a pool and you've got good hygiene and you don't pee in the pool, great. But if somebody's in that same pool and they pee, then you're really in trouble. So that's one of those things where you've got to consider who's managing the pool and who is helping you with that. So as you think about that pool analogy, in most captives, they're in a risk-sharing pool, meaning the person that's managing the pool, um, you've got to assume that they're trying to bring in members with the right underwriting and that they're trying to encourage them to take advantage of things that'll help them save money. Unfortunately, in insurance, for too many times and too many decades, people have been consumed by scale or size. And no longer is size or scale a differentiator in insurance because the cost of claims have outpaced the ability to size to really matter in that. So it really comes down to how are you managing your risk. True captive, we're a different model. So you still have members participating in the sense of we're like-minded, we want to do the right things. But instead of transferring the risk to the membership in this pool, you're transferring your risk to true captive. So at a certain threshold, you pass that responsibility over us. And true captive is experts in insurance and experts in risk. We own it. So it'll perform or it won't perform based on us. And since we're the primary investor, and we've invested in your plan to begin with, we have no other motive than to help that risk be as efficient as possible because that's how we're able to average 4% renewals year over year. So while the rest of the industry is experiencing double-digit renewals, we've been averaging 4% renewals for the prior 4 years. It's because we're managing risk like you're managing risk. You're trying to balance your profile so every year you're not being gouged with the pricing of insurance. We don't want to be gouged either. We want to be responsible. We want to treat everybody fairly. And so that's how we're doing that. And so it gives you the opportunity to not be exposed to any of the downside and only participate in the upside. So quick case study. This is one of my favorite ones. And this was early on. We look at claims on a daily basis. That's really important. You know, insurance in some cases, and I don't mean to be rude to insurance, but it's kind of dumb. It doesn't focus on looking at things so it can be strategic and be available to make a change in real time. It's really flat-footed and it's looking at things in the past where you can't make a change. It's really going to change much of what your current is doing. We look at everything on a daily basis, and we kept seeing these claims that were occurring, and they were really problematic. And when we found out it was an adolescent, it became even more problematic for us because we're families, we're parents, and those things are really important. And so when we dug into it, we realized it was an adolescent diabetic. And so we did something super radical. I joke, we reached out to the company and said, "Do you know anybody that has a child that is diabetic and having trouble?" And they said, "Know exactly who that is." It's a two household family. And when the child was with one of the family members, they had been able to do the education. And the other family had not been able to do that education. So when they were with that family member, and they had a diabetic episode, they were getting in an ambulance and rushing to the ER because they didn't know how to manage it. And so our response was, let's just hire them a private duty nurse at our cost, and let's give them the resource to be able to manage this. And before you knew it, both family members had the same experience. The child was able to understand how to manage diabetes and how to participate in different actions if and when their blood sugar was too high or they needed blood sugar. And a lot of people at that time asked us, "Why would you do that? That cost you $7,000 to hire that nurse." Well, the first reason was it felt good to be able to do that. We're not healers, we're not practitioners. So to be able to participate in something that was meaningful felt good. The other part is we're an insurance company, and paying $7,000 to save us hundreds of thousands of dollars is a no-brainer. On top of that, our customer experienced that savings as well too, because they're no longer experiencing those claims. So that's one of those ones where I like to point out that really what we do is common sense solutions to these problems. And there are things that you would do yourselves in your businesses if they were in a situation that you had experience with. So I will show, usually I can tap on it and it shows me this in three tranches, but this is in a nutshell, the program. So when I was telling you that $2.1 million at Alpha Point is saved, believe it or not, while you don't have exposure to high claims, the majority of the funds that you can still save or monetize sits at the self-funded foundation. So you accept a small piece of risk, but that leads to about 60% of the cost. Once you leave the self-funded foundation, that's where you transfer it to us at True Captive. And so we're managing the claims, we're managing the outcomes, and then we're sharing that with our members in terms of when there's wins and we don't spend as much money as we taken in, we share that with our membership as well too. And then finally, you have stop loss protection, and we do too at the captive to ensure if there are super high dollar claims, we have another insurance partner that protects all of us. So the collateral investment, a lot of times this is a foreign topic because in fully insured or self-funding or level funding, collateral isn't part of it. It's only something that's part of a captive and unique to it. And with the collateral, like I mentioned, you aren't being asked to make the large investment. So depending on the size of your business, it can be 20,000, it can be 50,000, it can be 100,000. So that's a key. And being able to participate in True Captive, unlike other captives, we're making that investment on your behalf. I think another thing is we're built on confidence. We aren't saying that you are needing to do anything that we expect you to do to have the outcomes that we do. We are tracking your data and your track record. Another thing that is probably uncommon, at least foreign, is the cash calls. So in other captives, because you are an owner, if the insurance doesn't perform well or you don't perform well, they can come back and ask for more. Since we are the investor, if there's anything that's needed from a cash perspective, we are the ones that pay for it. So it speaks a lot to, again, municipalities, nonprofits, school districts, people with fixed budgets that they're maximally protected, and that's a brand promise, and we're the only ones that do that in the country. Mentioned about the aligned incentives, I can't talk about this enough, but really the idea is ensuring that we all have the same goal. We want to make sure that you have sustainable products that work, And we don't just say that. We put our money where our mouth is, so to speak. We're investing in that. And so if we did say something that we couldn't do, we're only hurting ourselves. And I think that's really important to know that we're all really good on demos. We're all really good at telling you how good we are about different things, but we also put our money where our mouth is. So that's our brand promise. And then lastly, the access without barriers. This is for groups that might be strong performers, scratching their head about their increases every year, but maybe don't have the ability to write a larger check to join or feel comfortable joining something that perceives additional risk. So as I start to think about the part that makes us special, the first part is what made us popular. So again, being the only insurance company that makes the investment on your behalf, that made us popular with a lot of advisors and a lot of companies. And I'm proud to be able to do that. That was a result of a lot of successful hard work that we had to sell our last company and invest in this one. So I won't tell you that that's not a really key differentiator, but I don't think it makes us special. I think what makes us special is how we manage and mitigate risk. We are sitting kneecap to kneecap with you and your team. We're ensuring that we're looking at claims on a daily basis, and that allows us to be proactive. If we're flat-footed and we're waiting for the fire to come, then we're battling a fire that's already raging as high as it can be. It's better to capture a fire when it's smoldering, when it's not developed. You're protecting your castle. That's what we want to do because, a lot of times when people are experiencing some chronic or acute illness that's severe, they don't want to shop around. They don't want to think that they can buy a medical procedure like they buy a TV at Best Buy. There's a lot of angst with health because it's your most important commodity. And that's why we're doing it on their behalf, is saying, how can we help you be the most strategic and most satisfied consumer without having to feel like they are a consumer. That to me sometimes feels a little uncomfortable or icky to think about healthcare as I can be a consumer because you've never thought of it that way. We are meeting with you every 30 days, right? So we're at the company level. This isn't something that we see you at renewal time. We're excited that we want a company, and now we're going to see you next year when it's time to look at the results. We're embedded because we want to work with your members. And when we are able to have that big moment where somebody is successful in mitigating a claim or somebody's successful getting access to a therapy that they otherwise wouldn't be eligible for, those are the champions inside of your businesses that will continue to help you propel your insurance programs. Uh, I call this the lean in, the always in support. Answering a phone call when somebody is happy is really easy. Answering a phone call when somebody's upset because it's their health or their family member's health, sometimes people let the phone ring. Sometimes people don't answer emails timely. We're leaning in. I think that's probably when we're at our best because we never forget that we were the patient too. We were the employee too. And I think that's a core foundation of what we do. And the success is shared. So I mentioned before, you're not exposed to downsides. So if the insurance company doesn't run well, which that hasn't ever happened, but if the insurance company doesn't run well, we don't come to you. But when we do well, then we want to share in that with you because what we can do is say, if our companies didn't believe in the things that we were telling them and building trust and working together, then the revenue that we generate probably wouldn't be there either. And so we want to issue dividends to members that are eligible and share with them that because it does take a community to do this. And it's important that everybody feels that reward is received. This one is where I talk about discipline, and I think this is a key differentiator in how we underwrite. So the way that you're probably used to getting your insurance underwriting today is you see it in a spreadsheet. You're comparing your current against any other options that are available, and oftentimes what you're doing is you're looking at the pricing because the experience is all very similar. And then you're deciding, hey, how much do I need to save to alleviate in my mind the disruption that's going to occur because I'm changing carriers? Even though it's pretty easy, there's always the person that doesn't get the RX bin number in at Walgreens and they say they don't have pharmacy, but they do. Or somebody goes and they forgot to change their insurance carrier. And so when they go to the doctor, they get a bill. those things are in your mind as you're going, hey, is it worth changing for $50? No. Excuse me, is it worth changing for $100,000? Probably yes. And so that's how you're buying insurance today. And the carriers know that. And so when they want to win business, they simply underwrite to win. So they're turning those numbers into a compelling argument for you to say yes. That's what's wrong with insurance today. It's what's been wrong with insurance for a long time. Because if the risk is the risk and you just change the pricing of the risk still stayed the same. So if it's a 10 risk and you have to price it at a 7, well, the 10 never changed. And in fact, the 10 probably just got riskier because you have less margin of error. And so we're really good at finding data to help us prove what we want to price something for to ensure that that's sustainable. And then when we find something that is high cost, it's not a disqualifier. It's not something that is an excuse for us to charge you more. In fact, it's a lean in moment where we can say, hey, do you know anything about this? And we find out all sorts of things. People are in remission. That's something that they never had. Maybe that person's no longer on plan. Maybe that person is still experiencing that, but they've got a great treatment plan with their physician, and they feel like, remission or completion will be done within the next 7 months. And so we can use that as information to help us with our underwriting. So I say we underwrite to be correct. We're not trying to win. I'm competitive. I want our team to win every time they go out. At the same time, I also want us to be right because that's how we're able to operate at the loss ratios that we do and the 4% renewals that we have. That's not done by accident, it's done by discipline. And so we're not willing to take gambles that have been backfiring for decades. That's now why we're seeing the rapid increase in premium. I actually don't argue the rapid increase in premium. It's where it should be. But the problem is we're going there really fast because we can't outpace the risks that we took before. So I think that's really, really important. And when we enroll somebody, our focus is renewal right when we sign you up because we're already thinking about what do we need to do to drive a positive renewal and making sure that we're focused on sustainability. This one's a fun one. If you've ever talked to a self-funded provider or a captive, the no new laser rate cap is the biggest sales feature out there. It gives you the warm and cuddlies. You feel really good about it because first of all, whoever named a insurance risk a laser, I'd love to have a conversation with because that wasn't anything I would have named it. And then rate caps make sense. It's like I can't get an increase beyond a certain number. The problem is that you pay for it and it makes you riskier at renewal. It makes you take on additional burdens from other members and you lose some of the strategies. So we honor no new lasers. We want to use that as a potential tool that might be beneficial. So you may be a company that's risk adverse and say, hey, I'm afraid I want to cap my losses, but I'm willing to pay for the right to cap my losses. That's a strategy, and we'll discuss it. We want to think about lasers, and lasers aren't a bad thing other than their name. A laser, all that is saying there's a particular amount of risk and there's a particular price for that risk. So lasers could be something because if a particular amount of risk is highly unlikely, you wouldn't want to pay for it in the premium. You may want to put it somewhere else to think about how are you going to finance it differently. A lot of times, because we are so close with our members, we split lasers with our members. So if there's a particularly scary amount of risk, then we work together and say, hey, we'll take this on together and be financially responsible. And when we do that, sometimes your liability comes off the books because it's so close to where you are on that self-funded foundation. But that really does mean we're all in. Our investments on the line, our performance is on the line, our credibility is on the line. If you think about protective moats, most of you who are in businesses who are fully insured, you only get enough data to know a little bit. And that's a protective moat around a fully insured carrier's business because you are finding difficulty competing in the market as you have no data to say I'm a good or bad bet. Whereas our protective mode is service. We have no lengthy contract. We have nothing that's going to bind you to us other than we're participating in your insurance plan. But if you want to leave, you can leave anytime, but you're not going to leave because our service levels are so high. And so we don't have anything that's going to hold it back. And that covenant is something that sometimes will bind you to another carrier. We don't have that. So we're all in. Either we're good or we're bad. And if we're bad, we lose business, and that's bad because then I'm usually not a happy camper about that. We talked about responsible underwriting, but this is from a recent white paper from Skyward Specialty Insurance, and it's talking about the influence of the no new laser into the deterioration of risk. Because what it means is if something that needs some sort of strategery to get through and you're not doing it, you're just kind of putting it over here and forgetting about it. Well, you can't forget about it because it's something that occurs and somebody has to pay for it. And that first person that pays for it is the insurance company. The next person that pays for it is the employer group. And so if you are not focused on that, you're going to continue to deteriorate that amount of risk. And then what ends up happening is then you lose the no new laser rate cap. You're not allowed to have it because the carriers can no longer do it. And so we're really at an inflection point of understanding how to partner with companies better, which speaks well for us because that's always been where we've been. But I'm particularly happy that the market is trying to focus more on that. Not exactly happy that they had to be forced into it based on financial performance, but they're here anyway, and I think that that's a positive thing overall. Another case study we have, and we look at a company up in Pennsylvania. They had a very expensive drug well rig, almost $400,000 annually. So we were working with the PBM partner, and what ended up happening was the commercial seller or the manufacturer had a stipulation that they would cover this at no cost. However, when we submitted for this, they declined it, and we simply sent them a picture of their website where they said that they would pay for it. I got a very nice phone call, and they agreed to pay for it at 100% and then no cost to the employee, and it was drop shipped to the customer or the employee. And so those are those things that, again, that we're paying attention, we're leaning in because nobody wants to pay $400,000 in prescriptions. I mean, I would say that it's beneficial that that person has access to it, but that's a huge expense. And so the fact that we were able to get the manufacturer to participate, that I think speaks to our ability to work well with others in the industry. Again, only company in the country that invests in each one of our member groups. I think that that is a really big brand promise that we put our money where our mouth is. We talked about reduced volatility early on as one of the main components of a captive, and this is an illustration of what that might look like because you might be used to this whiplash or whipsaw of, one year I have a decent year, then I have a bad year, and then I hear premiums are going up, and then I hire somebody, and unfortunately they're sick, and then it just is up and down. But really, the idea of captive, and specifically for True, because of our sustained renewals, we want it to be almost commonplace as your renewal. It's not like you're not looking forward to it because you're in your meetings every 30 days, so you know how things are going. And then when you have your renewal number, you're feeling confident and comfortable that you are having a profitable business with good insurance, and you've also monetized your insurance with that leftover claims fund that you didn't spend. I think this is our last case study, but this is probably the funniest story. I have my favorite story with the adolescent diabetic. This is the favorite story, and I am going to sort of exaggerate, but I'll tell you when I'm exaggerating. So we had a member whose spouse needed a spinal fusion surgery, and it started to fast track. And when it fast tracked, that kind of raised our suspicion. And when we dove into it, we realized it was something that was beyond the clinical guidelines or diagnoses. So, if you know anything about spinal fusion, the indication was four fused vertebrae. That's typically reserved for combat veterans injured in the field of battle. Um, the underlying issue when we reached out to the member, this was his spouse. She was in a tremendous amount of pain and had been for a long time, and he just wanted her back. So he was willing to do whatever it took to get it done. And we asked for just a day to have a conversation and find out what was going on. So we ended up talking, and this is the part where I'm exaggerating. We did talk to the surgeon, and they were in their car. That is true. But I could hear wind in the microphone, and my mind was thinking he's, in a canyon, convertible down, wind blowing through his hair. That's the exaggeration. I don't know if he was doing that, but I do know he was in a car, and he explained to us what he was trying to do. And we started to realize that it wasn't the physician, it was the facility. So we called the facility and asked about a reduction in cost, and they said no. So we called some of our friends who own a surgery center that allows resident surgeons to come in and perform surgery at the surgery center. And this $480,000 surgery, I asked how much it would cost, and the man that owns the surgery center said, David, all of our pricing is online, so you can go look. And he said, but since you called me, it's $36,000. And we said, okay. And we agreed that it would be best if this person didn't have to travel for the surgery. And so we called the neighboring surgery center or hospital where that surgeon had privileges, and they agreed to do it for 45,000. And then wouldn't you know it, the facility that we were originally at now magically accepted $45,000. So a very quick ability for us to find out why is somebody doing this if it doesn't make sense, and then how can we create a better experience for that person. We could have had an even cheaper surgery if we sent her to the surgery center, but everybody agreed that traveling even after that was not in her best interest. And so while it was a little bit more expensive, ultimately came to a great outcome. So that was something that we're all very proud of, and we all collaborated really well together between the facilities and our advisors. And I think that's just an example of how we work like you would in your businesses. So, that being said, that's the end of me trying to make insurance sound fun. So now we will open things up for questions if there are any.
And one thing I do want to mention, David, is can you just talk a little bit after the questions about the assessment?
The assessment's really easy. Really, all we need is a census, preferably a dependent level census, so one that has spouses and children, then your current insurance plans, and then if you have any renewal history or a bill is just fine, because we're trying to compare the underwriting against what we come up with. It's how we keep ourselves honest, is saying, our methodology compared to where you're currently at. So if you could send us those things, if you are someone that's larger that does have what's called claims experience, where it does give you high cost claimants, that helps us even more, but it's not a requirement. It's more of a wish list item. So really simple stuff. Just need census, need your plan designs, and then your either a current bill or a renewal that'll help us ensure that we're looking at things the right way.
And it sounds from what you've explained, just because I'm not seeing anybody with any questions, working together and making a switch is easy, relatively easy. It would be as easy as someone changing from one plan to another. So can you maybe mention that again? I just, I think it's important. This is such a tremendous value. Like when we look at the savings for APH and Alpha Point, it's really phenomenal. And I know that all of our members, they're struggling, right? Because you have to look at your premiums and then risk reducing your coverage. And, so I think that this is a really great pathway not to have to do that. So maybe you
Yeah.
can speak to that a little as well.
It's very easy. I mean, again, it's no different than switching to another carrier, and we're trying to help with implementation to ensure that if there's any learning curve for the employees, which really you don't tell them they're in a captive. For their point of view, you've moved to a different type of insurance, and here's your card, and here's the logo. So whatever network we choose, in their minds, that's how they're going to go see their doctor. I've got Cigna, I've got Aetna, I've got United. So that part is really simple. But any of the things of learning, hey, I might have an opportunity if I reach out to someone to find out more about this procedure or this drug, I might be able to get it at no cost. And they're people that are my advocate. I can talk to them freely. And I think that it's really critical as you look at APH and you look at Alpha Point. They have the same sales hurdle that most of our customers do. And if I ever figure out a way to overcome this, in a shorter span of time, I'll be very happy. But it sounds too good to be true. That's what happens a lot is, gosh, why would anyone put their own money up when everybody else is charging money? Or why would people lean in? Or why would you share your profits with us? And if I could give somebody an answer that would make them feel good, then I would love to give them that answer. However, I haven't figured out a way to do it. But that happens a lot where people are thinking that this doesn't seem compatible with what they've known for insurance their entire lives. But as we become, larger and we're in 47 states, people have started to realize that, there is a company out there that does this. They want to do good by other people and they want to make a profit. I think that's a positive thing. When you create a positive experience and turn a profit, those are positive outcomes. So very easy. And I encourage you, if you'd like to have a conversation one-to-one, we're happy to do that. If you want to do the no cost assessment, welcome to take you through that. And for anything else, you'll learn what's going on.
We just got a
Oh,
question. You see
yep,
it?
I see that.
Great.
It says non-negotiable. So the only thing that we have are non-negotiables is we meet every 30 days with our members. So I can tell you with Kaiser, you'd probably keep the Kaiser population because Kaiser is I know Kaiser too well. I bought a company that was right across the street from a Kaiser clinic thinking we could convert them and bring them onto our insurance plan. And you would have thought I slashed everybody's tires. So you'd keep your Kaiser population, but then, for example, like the Anthem population, we would probably convert into another similar plan, just it would operate underneath our umbrella. And maybe we would still use Anthem. It depends on if you're fully insured or self-funded now. But needless to say, the only non-negotiable is that we meet with you every 30 days. And so the point for that is that we're staying connected. You know where you're at. We know what our responsibilities are, and most importantly, we're able to communicate what's going on in your company that might be creating some disruption, or there might be some angst, or heck, sometimes we do get to hear positives, believe it or not. But that's what I meant by non-negotiable. We just want to meet with you every 30 days to ensure that we're connected and we're operating appropriately. Good question.
So I do. We will be sending out following this call. We'll be sending out the slides that David shared, which has David's contact information. We encourage you to call him directly and set up a quick one-on-one. And then if you can, it's a simple process is to go through the assessment. I think, as APH and Alpha Point were, I think you'll be surprised at the quality of insurance that you can offer to your employees or maintain with your employees, and then what that looks like from a cost savings perspective. And I know we're all on razor thin budgets, so I really encourage you to have that call with David.